Here are 5 USMLE-style questions focused on Wernicke-Korsakoff syndrome, beriberi, and thiamine B1 deficiency. Question 1. A 60-year-old woman with a history of chronic alcoholism presents with confusion, ataxia, and ophthalmoplegia. She has difficulty standing and walking, and her gait is uncoordinated. Which of the following is the most likely diagnosis? A. Wernicke-Korsakoff syndrome. B. Cerebellar ataxia due to vitamin E deficiency. C. Multiple sclerosis. D. Acute cerebellar stroke. E. Parkinson's disease. Answer: A. Wernicke-Korsakoff syndrome. Explanation: this patient's presentation of confusion, ataxia, and ophthalmoplegia is highly suggestive of Wernicke encephalopathy, which is part of Wernicke-Korsakoff syndrome. This condition is most commonly associated with thiamine B1 deficiency, which is frequently seen in patients with chronic alcohol use. It is a life-threatening neurologic condition that can progress to Korsakoff syndrome, which involves amnesia, confabulation, and personality changes. Question 2. A 45-year-old male with a history of chronic alcoholism is admitted with altered mental status, nystagmus, and ataxia. The patient's family reports that he has been confused for the past few days and has trouble maintaining balance. What is the most appropriate first step in the management of this patient? A. Administer thiamine before glucose. B. Administer glucose before thiamine. Administer intravenous vitamin B12. D. Start corticosteroids. E. Perform a lumbar puncture. Answer A. Administer thiamine before glucose. Explanation: this patient likely has Wernicke encephalopathy, which is due to thiamine B1 deficiency. Thiamine deficiency can occur in alcoholics and presents with the classic triad of confusion, ataxia, and ophthalmoplegia. When glucose is administered to patients with Wernicke encephalopathy without thiamine first, it can worsen the condition. Thiamine should be administered prior to glucose to prevent worsening of the encephalopathy. Question 3. A 50-year-old male with chronic alcoholism presents with severe memory loss and confabulation. He is unable to recall events from the past month and frequently fabricates details about recent events. These symptoms have been ongoing for several months. Which of the following structures is most likely damaged in this patient? A. Medial dorsal nucleus of the thalamus. B. Basal ganglia. C. Substantia nigra. D. Cerebellum. E. Frontal lobe. Answer A. Medial dorsal nucleus of the thalamus. Explanation: the presentation of confabulation, memory loss, and personality changes is characteristic of Korsakoff syndrome, which results from chronic thiamine deficiency, often in alcoholics. This condition is caused by damage to the medial dorsal nucleus of the thalamus and mammillary bodies. Korsakoff syndrome is typically associated with Wernicke encephalopathy and results in anterograde amnesia and confabulation. Question 4. A 30-year-old woman presents with shortness of breath, swelling in her legs, and weakness. She is diagnosed with wet beriberi, a condition caused by thiamine deficiency. Which of the following is the most likely cause of her symptoms? A. High-output cardiac failure. B. Myocardial infarction. C. Congestive heart failure due to hypertension. D. Pulmonary embolism. E. Cardiomyopathy due to alcohol consumption. Answer: A. High-output cardiac failure. Explanation: wet beriberi is a manifestation of thiamine deficiency that causes high-output cardiac failure. This is due to systemic vasodilation, leading to increased cardiac output. Thiamine is necessary for proper mitochondrial function, and its deficiency impairs energy production in highly aerobic tissues like the heart. Patients can present with symptoms like swelling, shortness of breath, and weakness. Question 5. A 35-year-old alcoholic woman is found to have nystagmus, ataxia, and confusion. The most likely diagnosis is Wernicke encephalopathy. Which of the following is the hallmark treatment for this condition? A. Intravenous thiamine, B1, administration. B. Oral vitamin B12 supplementation. C. Intravenous magnesium sulfate. D. Oral folate supplementation. E. Intravenous potassium supplementation. Answer: A. Intravenous thiamine B1 administration. Explanation: Wernicke encephalopathy is caused by thiamine B1 deficiency and is a life-threatening condition that requires immediate thiamine supplementation. Thiamine should be administered intravenously before glucose administration to prevent the worsening of the encephalopathy. This treatment is essential in alcoholic patients or those with malnutrition to correct the deficiency and avoid long-term neurological damage. Question. A 45-year-old male presents with complaints of muscle weakness, particularly in his legs. He reports a history of excessive alcohol consumption for the past 15 years. On examination, he demonstrates symmetric muscle wasting, decreased reflexes, and tingling sensations in both legs. His vital signs are stable, but he appears to have signs of peripheral neuropathy. Which of the following is the most likely diagnosis? A. Dry beriberi, wet beriberi. C. Diabetic neuropathy. D. Guillain-Barré syndrome. E. Chronic alcoholic myopathy. Answer A. Dry beriberi. Explanation. The patient's symptoms of peripheral neuropathy, muscle wasting, and symmetrical muscle weakness in the context of chronic alcohol consumption are consistent with dry beriberi, a manifestation of thiamine vitamin B1 deficiency. Dry beriberi primarily affects the peripheral nervous system, leading to symptoms such as peripheral neuropathy and muscle weakness. In contrast, wet beriberi involves high-output cardiac failure and systemic vasodilation.